In today's presentation, we're going to look at burns. Burns are characterized by severe skin damage that causes the affected skin cells to die. A burn is damage to your skin tissues caused by things like heat, chemicals, electricity, sunlight, or radiation. Every year, about 2,000 Americans are treated for burns, and every year, approximately 12,000 Americans die from burns. The two most important problems with a burn are loss of body fluids and infection. The first and most immediate problem with a burn is the loss of body fluids, and the reason is loss of body fluids can lead to dehydration and electrolyte imbalance. If it's not stopped, it can further result in renal shutdown or kidney shutdown and circulatory shock. It occurs within the first 24 hours of the burn. It's important in a burn patient to be able to assess very quickly how much fluid has been lost. You want to replace what was lost, but you don't want to overload the system, and you don't want to give them too few fluids. So there is the rule of nines, which is a way to estimate just how much surface area of the body was involved with the burn. These are numbers that allow the physician to do a very quick assessment of what percent of the body surface area was actually involved in the burn. The anterior trunk is 18% of the body surface area. The posterior trunk is also 18% of the body surface area. Each leg is 18% of the total surface area. Each arm is 9%. The head and neck together are 9%. And the perineum, which is the anal genital area, is 1%. For the first 24 hours, infection is not a problem, and that's because in the area of the burn, the temperature was so high it destroyed any infecting organisms that might be there. However, after 24 hours, bacteria that are in the air can invade that open wound, and so IV antibiotics are necessary to treat a burn patient. View this video to see how burns are classified. There are three main categories of burns. They are first-degree burns, second-degree burns, and third-degree burns. Of the three categories of burns, the least severe are the first-degree burns because they only involve the epidermis. The symptoms of first-degree burns are redness, warmth, tenderness, and pain, and it takes about 2 to 3 days for them to heal. A common example of a first-degree burn is a sunburn. Aloe is a common houseplant that's very effective in treating sunburn pain. The aloe vera plant has been used for thousands of years to heal many different conditions, things like burns, wounds, and skin irritation. It's grown in the subtropical and tropical locations like South America, Latin America, and the Caribbean. Aloe was one of the most frequently prescribed medications throughout most of the 18th and 19th century, and even today remains one of the most commonly used herbs in the United States. It contains a gel, we call it aloe gel, that's made from the central part of the aloe leaf. And again, it's a common household remedy for minor cuts and burns, as well as sunburns. Aloe contains active ingredients or compounds that help to reduce pain and inflammation and stimulate skin growth and repair. Second-degree burns are more serious because the damage extends beyond the top layer of skin. It includes both the epidermis and the upper dermis. This type of burn causes the skin to blister and to become extremely red and sore. Some blisters will pop open and give the burn a wet or a weeping appearance. The symptoms are similar to first-degree burns, but again includes blisters. The healing takes about 3 to 4 weeks, and in most cases there's little or no scarring. Both first and second-degree burns are called partial thickness burns because they do not go all the way through the skin. Here are some home remedies for burns, and you'll notice that one of those home remedies is the aloe vera plant that I mentioned. In this slide, you can see a typical second-degree burn, which includes the presence of blisters. A third-degree burn is referred to as a full-thickness burn because this type of burn destroys the outer layer of skin, the epidermis, and the entire layer beneath, or the dermis. The symptoms are the burned area can be white, red, or black. Initially, there's no edema. And remember, edema means swelling. There is no pain because you've burned through the nerve cells and can't feel the pain. In most cases, skin grafting is necessary and scarring will usually occur. In the case of third-degree burns, Before the burned area can heal properly, a procedure known as burn debridement must occur. This is where the burned area and cells are removed, and there are several ways to do this. You can remove them surgically, chemically, or mechanically. The procedure is most often done for 3 reasons. That is, to remove tissue contaminated by bacteria, foreign tissue, dead cells, or crusting, to create a neat wound area to decrease scarring, and to aid in the healing of very severe burns or pressure sores. After this, something called a living bandage can be applied. This will help protect and aid in the healing process as well. The following 2 slides are very graphic illustrations of critical burns. If this is something that would make you uncomfortable, please do not view these slides. Here are pictures of third-degree burns. A third-degree burn is a full-thickness burn and involves both the epidermis and the dermis. Please view this short video of how to treat second and third-degree burns. A critical burn requires immediate medical attention. These burns are potentially life-threatening, disfiguring, and disabling. Unfortunately, it's often difficult to tell if a burn is critical. Even superficial burns can be critical if they affect a large area or certain body parts. By definition, a critical burn can be a second-degree burn that covers 30% or more of the body, a third-degree burn that covers 10% or more of the body, a third-degree burn to the feet, hands, or face, and a high-voltage burn. The following 2 slides are very graphic illustrations of critical burns. If this is something that would make you uncomfortable, please do not view these slides. Both are considered critical burns because they are third-degree burns to the hand. These also are critical burns because they are third-degree burns to the feet and to the face. The treatment necessary for burns depends on their severity. Sunburns and small scalds can often be treated at home using things like ibuprofen, acetaminophen, soaking the wound in cool water for 5 minutes or more, applying aloe vera gel. But in the case of more severe burns, more serious treatments are required. These include IV fluids, NG tubes, G tubes, and hyperalimentation. Remember that the most immediate problem in someone who has had a critical burn is the loss of body fluids. So we want to give them fluids by a process called intravenous therapy, which is the infusion of liquid substances directly into a vein. We can use this to correct electrolyte imbalances and to deliver medications and to replace fluids that this person has lost. The second treatment that can be used for someone with a critical burn is known as an NG tube. NG stands for nasogastric, and that's because this is a tube that goes through the nose and into the gastric area or into the stomach to feed the person. This is usually a short-term solution. Another treatment for someone with a critical burn is a G tube. G stands for gastric or gastronomy tube, and that's because it's a tube that's inserted through the abdomen and directly into the stomach and delivers nutrition. Not only is this used for burn patients because they need so many calories for tissue repair, but sometimes this is a treatment used for children who have trouble getting the fluid and calories they need to grow. The last treatment I mentioned for someone with a critical burn is known as hyperalimentation. Hyperalimentation is a procedure in which nutrients and vitamins are given to a person in liquid form through a vein. It's only given to people who cannot get nutrients through the intestinal tract. Remember that these burn patients need so many calories, and it's important that we be able to supply the food that they need, the calories that they need, for the repair process to occur. This is a picture of what the food used in hyperalimentation looks like. On the average, females require about 2,100 calories a day, and males about 2,700 calories a day. In the case of a burn patient, they will require anywhere from 5,000 to 10,000 calories a day. This is because they need additional calories for the repair process to occur. The problem is most of them have no appetite.